Okay, let's see. Are you able to see my screen, everybody?
Yes.
Okay. So INSPIRE-D is a acronym, as you just mentioned. It's the Integrated Nutrition and Screening Program for Informed Risk Education for Diabetes Prevention. Today, we'll briefly discuss a complete overview of the grant, which includes what are the goals and objectives, what are the collaborative organizations, a quick timeline, and some next steps. So this is the whole the org chart for the grant. Now we have a national office, then we have all these community advisory community organizations, which include government, including DHEC, and academic, including MUSC, hospitals, including Roper St. Francis and MUSC, a community-based building, which is Spanglish and Secular Benestar, and nonprofits like Low Country Food Bank and Low Country Grocery Store and Amazon as well. The project team consists itself of a project director, which is myself, and then we have a program coordinator, an outreach coordinator, a data analyst, and in addition with that, we have administrative assistant helping us with all the works, the logistics and the clerical work, community health worker, and a patient navigator. In addition, there is the whole SHIFA team as well that helps with this program. So this grant is based on the Healthy 2030 guidelines. So Healthy 2030 is a data-driven national objectives to improve health and well-being over the next decade. The grant requirements were that we address 2 social determinants of health to improve 1 LHI. LHI is a leading health indicator, which addresses important factors that what is the major causes of death and diseases in the United States. And we chose LHI as to be the diabetes prevention. Now, the crisis of South Carolina ranks 8th in US for diabetes among population, and diabetes is the 7th leading cause of death in the state, which is surpassing drug overdoses, suicides, and homicides. So diabetes prevalence among adults have risen from 12.1% to 13.6%. And also the cases of pre-diabetes have drastically increased from 6.7 to 10.9 in recent years. So how are we making a difference with this? By collaborating with state agencies, local hospitals, academic institutions, and community organizations, we're going to implement a comprehensive evaluation and track progress and improve strategies based on the community feedback. So this grant has 3 objectives. One is community assessment, where we will be doing surveys, focus groups, as well as key informant interviews to learn about what is the community feedback based on the current issues that are people living with pre-diabetes and diabetes. What is their nutrition care knowledge? How accessible is healthy food for them? What are their attitudes towards healthcare and education providers? And what are some of the perceived barriers for getting the care? That's one objective. The second is early detection and self-management of diabetes. So for this, we will be implementing a lot of outreach events, low-cost screenings and education sessions to target the populations to enhance early detection and self-management. And finally, a third objective is enhancing food literacy and access to diabetes prevention. So that is to improve health literacy and access to nutrition by doing more food distributions and having targeted programs like Food Share. This is a partner collaboration that we just discussed. A quick timeline, how we're going to be doing this. So by 11 to 12 months, which is by July, we will be developing an action plan based on the community health assessment for the next 3 years. But simultaneously, we are also doing our other events, which is 10 health fairs, flu vaccine campaigns. The community health worker will be doing 3 short workshops for diabetes risk identification, home visits, risk assessments. Patient navigator is going to help us within the clinic to increase our screening. Targeted campaign by hiring media, different organizations, as well as mental health workshops, and MUSC is doing gestational diabetes classes. And with the help of Roper St. Francis, we'll be doing the CDC-approved diabetes prevention curriculum. In addition, the third objective about the health, we are doing Fresh Expresses, which is community fair distribution of groceries, turkey giveaway, grocery store tours, and cooking matters classes. And in January to August, we'll be doing a specific curriculum, 12-week curriculum for education about healthy eating through Low Country Grocery Store. And in addition to that, we're also doing a food literacy campaign. I think my time's up. I'm going to give you a couple minutes to ask any questions.
Thank you, Dr. Khan. I'll ask. Some of the areas I know that you're doing this in the countywide or larger metro areas, correct?
Yes, right.
Are you having focused specific areas in any one community at all?
So yes, the community health assessment is based on, we're going to be doing in the Tri-County area, but in each, we have identified certain communities in health sector, religious sector, education sector, as well as nonprofit. So we will be choosing certain, only for the key informant interviews. Those will be the sectors that we'll be choosing in particular locations. However, the survey is open to everybody. It's an online survey, and that could be done throughout the Tri-County, even throughout the state.
Can you provide us with a link I could share with the group for the
surveys?
Yes.
Yes, I will. Yeah, I will send both the English and Spanish version of the survey. And there is a $5 reimbursement for each survey that is completed. So our campaign that we are starting is 5 for 5, which means give us 5 minutes and we give you $5.
Very good. Any other questions for Dr. Khan? Well, thank you very much for sharing this. We appreciate it. Thank you for thank you for your time.
Would you like me to leave?
No, you're welcome to stay. But if you need to go, we certainly understand. So
okay, thank you so much.
Yeah, you're always welcome to join us. So yeah, every first Wednesday of the month. So
okay, thank you. I'll take leave. Thank you very much.
Thank you.
Bye. Bye.
All right, so next on the agenda, we have our suicide prevention resources in 988. We're very fortunate to have Jessie Barnes with us with the South Carolina Department of Mental Health Office of Suicide Prevention, and she's going to share suicide prevention strategies and the use of 988. So go ahead, Jessica. Thank you.
No problem. Thank y'all for having me today. I am also going to share my screen. I was able to pull together a little PowerPoint for y'all today. So you should be seeing the 988 marketing PowerPoint. What I'm going to go through is just some different marketing strategies we as a state have done. I am the state lead for 988. So what that means is I help coordinate the 2 call centers. I work closely with Charleston Dorchester Mental Health Center's 988 call center and Mental Health America of Greenville County's 988 call center. Together, both of them are answering our 988 calls for the state of South Carolina. So to move forward, some of the things that we have done so far with marketing strategies is we started out with doing some banner ads and radio ads across the state. And when we received the heat map back from the marketing agency, we were able to cover the entire state. The only pockets that were not shaded were our state parks. So we were happy with the outreach that we were able to do with that. We're balancing when 988 launched in 2022, not wanting to over market and then put a strain on our call centers, but gradually do it as our workforce was increasing. So that's kind of the theme that we're seeing now as I go through our other different marketing strategies. So that radio and banner ad campaign went from November to April of 2024. And then in December this past December, we started doing a bus ad. So you'll see them on buses, bus shelters, inside the buses, around different areas across South Carolina. And we've been seeing them pop up. They're starting to put them on the buses now. So I get really excited every time I see a place. I've had somebody message me in Greenville when they saw a bus shelter that had the 988 ad on it. And then I've been seeing some around Columbia. There should be some in Charleston as well. And then we also were doing some smaller communities and rural areas in South Carolina. One of the things that has not started yet, but we are in the process of also doing some billboard ads to really connect the 988 crisis care continuum. So 988 is more than just the lifeline. The lifeline is the piece of 988 that is somebody that you can call when you need help or somebody that you can talk to. The other piece is a person that can respond, which in our state is mobile crisis. And then the third piece of 988 is a safe place to be, which would be our crisis stabilization units. So currently we have a crisis stabilization unit in Charleston, and the Midlands area is working on opening up their crisis stabilization unit as well. So that is an area we're trying to grow in. But with different 988 advisory board committees that we've gotten a lot of feedback that people are unsure of who to call first, whether it be 911, mobile crisis, 988. So we're trying to do something that can really explain that crisis care continuum. Another thing that we are doing, I'm putting it under the category of billboards, but it's also in progress, is we are going to be going to high schools across the state and advertising and giving out resources at different sporting events and championship games that are happening. We're starting with some winter sports that'll be wrapping up, going into spring and summer sports, and then we'll pick it back up in the fall again with some fall sports. So I'm excited to bring that because our adolescents and young adults are a high-risk population when it comes to suicide. One of the other things that we've done is our office procured around 250 standing banners, and we distributed those banners across the state, and they were to go in different places like waiting rooms, emergency departments, places that people can see and may need the resources. We had a lot of school districts reach out and ask for a banner, so we give banners to school districts. We had different hospital systems reach out wanting to put them in waiting rooms, and a couple, like the city of Columbia, reached out and asked for a banner, so we were able to provide them one. So that was something that we were able to complete, and all of this has been thanks to a SAMHSA grant that we have for 988. So part of a required activity with that grant is to enhance marketing and communication. So we were grateful that we were able to do some of these things and continue to do some of them as we move forward. Our grant is a 3-year grant and will wrap up in around September of 2026. The last thing that we do is something that we do continuously, and that is we provide print flyers, wallet cards, things like that have the 988 resource on them. Anybody can request them from my office and we'll happily share them out. We also can send out PDF copies if anybody is interested in them. And on this slide, I put just some examples of some of the things that we've done or we have found in the community. I wish I had a photo of the bus ads. I do not, and I could not find the radio clip to be able to do that audio of what that sounded like. But what you're seeing is a lot of that. We have pull tab flyers that are about the different access lines that people can have. So 988 has a deaf and hard of hearing access line. They have a Spanish line where you can press 2. The veterans line, you can press 1. And wasn't able to put it on this PowerPoint, but there is an LGBTQ plus youth access point where they can press 3, and then they can go to that specific part of 988. The one in this upper left-hand corner is our general 988. So if you just need to call and talk to somebody, you don't need a specialized service within 988, you can always just stay on the line or press 0 and you go straight to that call center, which will be routed to one of the 2 call centers here in South Carolina. We try to provide material, and we do a lot of marketing where we put the 988 logo on it. You'll see this logo throughout the PowerPoint, and that is something that has been branded with 988. And then these are just examples of what the banners looked like. So a lot of the print flyers, all of those, we have some decal stickers that we do provide out as well. We'll happily mail anywhere in South Carolina for anybody that is requesting it. Sometimes there is a little bit of a delay because we might have to go to our print shop and print depending on the amount. So what we do is we really stay in line with SAMHSA's recommendations for marketing. So this is just a small snippet of what SAMHSA has available really to the entire public. So the marketing we definitely have pride and want to be able to do this across South Carolina, but it doesn't just have to be our office. So anybody has access to the SAMHSA Partner Toolkit, and I put the link, and I'll share this PowerPoint out so you can click the link as well. And it will go over things like recommended color palettes with the hex codes, icons that you can download. They have stock photos depending on what you're trying to do outreach for. They have the 988 logo, both in white, black logo, one with a background, without a background. And for different, like y'all were talking about, there's a lot of awareness happening within the month of February. They sometimes will also post one pagers that you can download and print out as resources depending on what is happening that month. It's not for everything that is happening, but they do try to keep it updated pretty regularly. So our office really relies heavily. We're constantly checking this partner toolkit to make sure what we're putting on our material is as updated as possible. So I know there was some talk about youth and what we were doing for our youth to have more awareness around 988 and suicide prevention resources. So in the fiscal year of 2022, they were able to pass a bill. I call it the Student ID Bill, and that's kind of been its short name as we've talked about it in the past. And this went into effect in July of 22. And what that is as new student IDs are being printed, it is a requirement by law to have the 988 Lifeline on the back of the student ID, as well as at least one other crisis resource. Now, this is only for 7th grade and older. We are in communications with the General Assembly to see, is there a way that maybe we could expand this to other age groups as well, because we've been seeing a wide range of people who are calling into 988. And some of the feedback that we have gotten from different people was that they felt like having this resource just printed on everybody's student ID made it more accessible for those children to be able to reach out and call for help, because they're not just giving the resources to maybe people we think might be at risk. Because when it comes to suicide or a mental health crisis, it could affect anyone across multiple different demographics. And you don't want to just give the resource to somebody that you think might need it, because there may be another person who might not be showing as much of these risk factors or warning signs as some of the other kids. So this is blanketly letting everybody know that this number is out there for you to use. And again, it's only as new IDs are being printed. So I'm hopeful as we go through a couple of different years that eventually every student who is in 7th grade and higher education will have that number printed on. But like when I was in high school, I got one ID my freshman year, and then unless I lost it, I did not get another ID printed. So that was just a way to make sure we were phasing into it without putting an extra cost on a lot of the IDs that had to be printed. So that's a little bit about our student ID bill. Our office also does different partnerships with people all over the state, especially when it comes to marketing or suicide prevention. I only highlighted a couple. South Carolina Parks, Recreation, and Tourism is putting up 988 signage in all of their state parks on the Welcome Center buildings. And then we were also able to provide them decals to put on their state vehicles. So they were seeing a lot of people tend to come to our state parks for some health, wellness, but also maybe to have some time to themselves if they're struggling. And unfortunately, there's been a couple suicide deaths in our state park. So they were really wanting to make sure that they were trying to put out resources to people who might be going there in times of intense struggle. South Carolina PIVA put a resource called Credible Minds on their webpage. And Credible Minds is what we call a one-stop shop for mental health well-being. It has research articles, resources, self-care tips, mental health questionnaires you can take, and a resource tab that will give quick access to different resource numbers for people. And that is available to everybody in South Carolina. The South Carolina Mobile Crisis Program was able to procure this for everybody to have access to. So I'll also make sure you have a link to that webpage as well if you are curious about it and want to look into it. The South Carolina Vocational Rehab, we worked with them to print out a large amount of flyers to put up in all of their offices across our state. We were just able to hand it off to them right before the snow hit. They were doing a large all-staff meeting, and so we dropped it off, and then I think the next day the snow came, so I was glad of the timing that we were able to get it out to them before everybody was kind of locked in with some of the snow. And another thing that we did is we worked with City of Columbia. We gave them some window clings and flyers that they were distributing and putting out across their town. And I am available for questions. One of the things that I have also divided out is I am a great point of contact. If anybody's interested in any of our PDF flyers, I can email those out, or if you're wanting some printed, I can definitely mail some to you. And then we also do training. So we do suicide prevention training across the state. And I put our training coordinator's name. Her name is Miranda Beaver. We have a list of things from gatekeeper training. So just a self-paced online 1.5 hour, but you can start and stop it at any point, that goes over risk factors, warning signs for suicide. You can practice asking the question about suicide, and all the way to a 2-day in-person training that people can explore if they're wanting to learn a little bit more detail about how to help somebody who's experiencing a crisis. So I did put both because when we partnered with Parks, Recreation, and Tourism, we did something similar like we are with y'all. We were talking about ways to put the resource out there. And then they were wanting to also train their staff to help understand the risk factors and warning signs. So I did put both so that y'all will have the contact for different parts of our office. And we do also do a lot of the trainings close with Charleston Dorchester Mental Health Center. Sometimes we work with their training coordinator, host trainings there as well. And I'll be available for questions too about anything y'all may have.
Thank you, Jessica. I appreciate that. And I did want to call on Jonathan Kessler to see if he had anything to add on here.
Yeah. Thank you very much. And Jessica, I'm looking forward to the Hope Rising conference coming up as well. It was fantastic last year. So if we get a flyer out to everybody, I think that would be wonderful. So yes, I'm with the VA, suicide prevention, and 988, we just can't get the word out strong enough, even with our veteran population utilizing option 1, that's for military and for a veteran population. We have seen the call increase with that, and those that are enrolled in VA or interested in resources do receive that through the national call centers. But I do know that through the Charleston Dorchester Department of Mental Health, that sometimes they're comfortable just sticking with the local call center and not pressing option 1, which is absolutely an option as well. When I'm out in the community and tabling and things of that nature, the entire table is 988. And so oftentimes get almost testimonials about folks that have called say, hey, look, this has really helped me. And occasionally when I have a veteran that's, asking about the service, it's so very timely to have this peer connection with somebody who's experienced it and said, hey, don't hesitate. Really, they're there to help you 24/7. So that's been quite remarkable. Through Paul, through this coalition, the email came out with the annual update with the Boeing Center for Children Wellness by Dr. Key. I had reached out to her and to a colleague, and then got connected with Dr. Edwards, who I know is part of the Governor's Challenge Suicide Prevention, that Jessica's always there as well and offering updates and information. And so we have started a dialogue about maybe increasing from a mental health standpoint or a wellness standpoint, in addition to the expansion of working within schools, but identifying Purple Star schools. And those are schools that are, there's a heavy population of military children. And part of the work that I work in with community engagement or partnership coordinator is also to identify and assist the children of veterans and military. So I really love the fact that it's not simply just veterans, but we're looking at our future veterans and our military children. And I was a military brat, and there's a lot of special considerations in that we move quite frequently, and the friend groups and the peer connections and such can be very, very fragmented. So that's a population that we really especially want to support. All that to say is that we are working together and have another meeting coming up to talk with the Department of Education, Dr. Priester, and then the state coordinator with MCEC, which at the moment is Military Children. I can't remember the rest of the acronym. We love acronyms. Coming up later this month to see what we can do and enhance. So Jessica, the idea is not to step on toes or duplicate efforts, but just to make a concerted effort to reach out to that population as well.
Oh yeah, and it is a group effort, especially when it comes
Yeah.
to suicide prevention. It does take an entire community and all communities to work together.
I did want to ask you, Dr. Edwards had inquired about other ways to enhance the ID, the student ID, and one thought had come up, and that would be to be able to provide the stickers with the 988 logo on it. Someone had announced, and I don't have a kid in high school anymore, but they said that the new IDs didn't specifically have 988, but it did have that information, and that sounded off to me. And I just wanted to get clarification on that.
The law clearly states that as it's being printed, it's supposed to have the number on it
Okay.
and one other
Very good.
crisis center. So if they don't have it, I don't know how that communication got there, or it could be they have an older ID,
That could be
or
it.
the school was doing something already prior to the law going into effect. So they may have had some resources on the back of the ID, and then the ID was printed and they still have that old one.
Understood. Okay. I thought the sticker idea was a sticker idea was good for those that have older versions of the card moving forward. So
Yeah, that might be an option. We can definitely try to see what we can get with helping out with providing some stickers.
and then I just wanted to, and I'll send this forward, Paul, if you feel it's appropriate. Berkeley County is hosting a conference on March 6th. So I was fortunate, asked to if I could table while there. But it's being emceed by Dean Stevens, who most of us know from the radio, right? From the radio. And Dom Cooper, she was a suicide aftermath speaker, and she had lost her son in a parking lot of a high school several years ago. So she's a very strong advocate. And the program is called Breaking Barriers. And it's going to be an open conversation about suicide, and it's going to invite in the community parents, and special emphasis on please bring your students. Please bring your students to dispel myths and have these conversations. And I think we need more of that. So the article that was forwarded by Dr. I can't remember now, but Paul, that you'd sent out, I thought it was very, very timely. That we absolutely, like Jessica's saying, we just need to get the word out there, break down the stigma, and let folks know that help is available. That takes a lot of courage, but also to help train up our students to support one another, because that's what we're asking with our veterans, to be able to be that person, to be the one that recognizes. And so we also provide training to our veterans and veteran-facing organizations, similar to what South Carolina Department of Mental Health performs. I think the only other thing I had to ask is every year the VA does publish a suicide prevention report looking at 2 years past. And so our report came out in December of just last year. And so we're seeing some improvements. Our women veteran populations, the death by suicide is decreasing. So that's significant compared to the year prior. That was a really heavy group that was dying by suicide. But we still have a lot of work to do. The numbers continue to increase in our veteran population. And I'll just, selfless marketing, I'll just share that we do have a coalition here in the Dorchester, Charleston, and Berkeley County for veterans. So it's the Veteran Suicide Prevention Coalition. Paul and April have, participated in that. This year, we're really looking forward to getting kind of wheels on the bus, so to speak, since this kickoff was last year, and actually moving forward and having activities, events, and special programming to help support the veterans and military and their children in the Tri-County area. So it's a big ticket, but I know we're capable of it. We have wonderful, various sectors of the community that are participating in this coalition. So I'm really looking forward to 2025 in that regard, just to see, what this coalition comes about and moves forward. So I can send out a calendar invite for anyone who's interested. They do meet the third Tuesday of the month, at the American Red Cross North Charleston. And we invite anybody and everybody to come forward, because as Jessica was saying, it really is it's a all approach, everyone at the table to make this work. Mm-hmm. That's all I got. Thank you.
Great. Thank you. Any questions for Jessica or Jonathan? Paul?
Just the one question, the PTA associations, do y'all, and you might have covered that, and Maggie maybe can answer because she does a lot of community work. How is that connection happening to help get that message out to the parents about what's available out there.
Yeah, we as much as I would like to say we could try to be in every place everywhere, I know we've reached out to several different organizations. I have 3 outreach coordinators that cover the state to do really groundwork on the ground, reaching out person to person to do that kind of stuff. We try to post things on Facebook, and we've had a couple people share it with different, I don't know if they've shared it with the parent teacher associations, but we've had foster care associations take up on some training, some resources to provide. I've worked with different programs across South Carolina where at least I've given them the information, but I definitely think it's an area we could get into more.
I was just thinking with it being on the back of their badge, parents need to know that that's something they can tell their child more about, or even help if they don't have a sticker, get them a sticker to put on it of some type. But Maggie, maybe you can talk about what's going on locally. I'm not sure.
Yeah, that's a great question. I'd love to connect more to talk about how we can, use our connection to share with our PTAs, PTOs. We have school improvement councils in every school as well. So happy to make that connection and
one example that comes to mind is I just recently talked with the Governor's School for Agriculture, and they're thinking of putting some of our resource flyers in the orientation packet that also goes to the parents.
Awesome. Yeah, I'd love to connect more offline about that.
And then I'll say the same thing, that what Columbia, y'all have done with Columbia, I'm sure that we could also replicate in our cities around this area between Mount Pleasant, Charleston, North Charleston, etc. So whatever we can do, and whether it's through Stacy or just through Jennifer, just let us know how we can be a bigger player to help you as well too.
That'll be great. Thank you.
Great. Any other questions? Well, thank you, Jessica and Jonathan. Obviously, critically important work that you're doing, a lot of work, and we appreciate it. And I'm sure you're already saving lives, and we'll save more as we go along here. And I think it was really good to have Jessica, Jonathan, and Maggie all on this communicating. So I think that was a great conversation. So I appreciate everybody's time on that. If there's nothing else, no other questions on that, I'll move on to item number 5, our community health update, and I'll call on Dr. Katie Richardson. I can't hear Katie. I don't know if y'all can hear her.
Can you hear me?
I hear you now.
Can.
Yeah.
Okay. I very much appreciate the discussion about 988, and it grew out of a commentary that the Post and Courier published not too long ago. Paul actually shared that with the agenda, so I would encourage you to read it. And one specific recommendation that was made by that physician, and I forget his name also, was that parents could even pre-program 988 into their child's cell phone as a way for when they might not have a badge with them. And I have 2 high school students, and at least my Charleston County students don't have 988. They do have a suicide prevention number, but it's like a 1-800 number. And so I don't know if I do have a 9th grader, so I think he's gotten a new badge. So that might be something that Charleston can look into, sort of moving towards having 988 on the back of those. I thought Jessica said that it's required. I thought when I read the law that a number is required, but not necessarily 988. And I think Dr. Key said, or someone said that there was a bill to require 988 specifically, but it did not pass. So 988 is an option, but I think it's, from all the things we said, it really is the best option to use, and we should be encouraging our schools to have that as the number on the back of the badge if it's not already. I want to touch on 3 things today. I always start in the winter with respiratory viruses. we are seeing a pretty large spike in our influenza-like illness and our influenza or flu diagnoses in people who go to the emergency room. Flu continues to increase in all regions across the state. There were 9 deaths in the past week. That it totals 45 now in South Carolina for this flu season, 843 hospitalizations currently, and we are about to the peak that we saw last year with influenza-like illness. So it is not too late to get a flu vaccine. They do work around 2 weeks after that vaccine is received. So we are still very much recommending that folks seek that out, as well as stay home when sick and practice good hand hygiene and cough etiquette as well, which can include coughing, into a tissue or into your elbow rather than your hands, because that really increases the spread. Thankfully, we are not seeing increases right now in respiratory syncytial virus or RSV and COVID. So those remain low among emergency department visits. That could change at any time, but we are grateful for that. And any continued vaccinations and other prevention measures are definitely helpful in keeping those numbers low. I also wanted to talk about some free testing days coming up at all of our health departments for sexually transmitted infection and hepatitis C testing, as well as HIV. Our next free testing day is actually this Thursday, February 6th. It is in honor of National Black HIV and AIDS Awareness Day. In South Carolina, 27% of our population is African American, but 63% of all diagnosed HIV cases are in African Americans. And additionally, 52% of new HIV diagnoses are among African Americans, really underscoring the need for increased testing and prevention efforts. And so we welcome, we prefer folks to make appointments, and I will put that appointment line in the chat. But walk-ins are also accepted as much as we can during those days. So February 6th is the next one, and after that, March 11th. So I'll talk about that one more next time, but would love your help in getting the word out for our communities to be able to take advantage of these free testing days. And finally, thank you, Kevin, for your background, and Paul for wearing red. February is Heart Awareness Month. Friday is actually the day that is specified for wearing red to raise awareness for heart disease being the #1 killer here in South Carolina and across most of the state. So I would encourage you to have your workplaces consider wearing red on that day. And heart disease is really the leading cause of death in men and women, and people of most racial and ethnic groups. 1 in 5 deaths in the United States was caused by heart disease in 2022. And what we see and what these 2 handouts really discuss is that high blood pressure is the leading cause of heart disease. Nearly half of U.S. adults have high blood pressure. This puts them at risk for heart disease and stroke. And just 1 in 4 people with high blood pressure has it under control. So these are 2 handouts that I found and shared with Paul that I would encourage you to help us share with the rest of the community. This one is 25 ways to take part in American Heart Month. Some of these things are committing to a walking schedule, participating with your workplace or organization in a STEPS contest, trying a new heart healthy recipe weekly, making television watching more active by doing some sort of exercise like jumping jacks or push-ups during the commercials, and continues about posting flyers around your workplace, encouraging local representatives, and hopefully this includes the city of Charleston, to post statistics about coronary heart disease in our area on social media sites, working with local recreation and fitness centers to spread the word online about the importance of physical activity. So the other one that Paul shared first says, take action for your heart, get started. Talks about the importance of sleep, healthy eating, maintaining a healthy weight, being more active. Smoking is a large risk factor for heart disease, controlling cholesterol and blood sugar, managing stress, and then going back to controlling blood pressure as well. And finally, the importance of self-care and social support. And so these are some of the many resources out there for Heart Health Month. And I think I will stop there and take any questions, but thank you, Paul, for sharing those, and for these 3 websites that Paul put up, these handouts and many other resources. These are sort of the 3 that I found that were most helpful. And so thanks.
Thank you, Dr. Richardson. And I see Maggie's got a thumbs up. I don't know if you were trying to be recognized or if it's just a thumbs up, but okay. All right, great. Well, thank you very much for that, Dr. Richardson. We appreciate it. Any questions for Dr. Richardson? All right. If not, we'll go to our community health and wellness updates. And I'll just ask you if you have something to share to please raise your hand. Anything else? Lisa Burbidge.
Hey, everyone. I just want to make sure that everybody knows I'm still running Medicare diabetes prevention programs up in Somerville and Goose Creek. So if you know anyone who lives in those areas, these are free programs if they're on Medicare. And we do have to check all that out. But Goose Creek and Somerville, we're still taking new participants. So Dr. Richardson, anybody on this committee who knows someone who's 65 and older and on Medicare, this is a free program. So I just want to put a plug out there for it.
Great. Thank you, Lisa. Any questions there? All right, Morgan Huey.
I don't have any questions, but good morning, everyone. I just wanted to kind of dovetail off of Dr. Richardson's last announcement and share a few things related to promotion of physical activity in our community as a main way to prevent heart disease starting at a young age. So today is National Girl and Women in Sports Day. So just wanted to highlight that. And our children do not meet physical activity recommendations overall, and girls are less than boys throughout childhood, and that really dips in adolescence. So girls being involved in sports, in dance, and different programs really can build their confidence in lifelong physical activity. So I just wanted to highlight that. On that note, the City of Charleston's recreation guide for spring 2025 is out and open. I'll share that link after I finish this announcement. So a lot of low to no cost programs and the facilities that our city offers for physical activity. There's a 5K this Saturday at Hampton Park called Building Healthy Communities, 5K walk and run. So there is a cost for the run, but there's also an expo and a raffle that has a lot of different organizations and businesses that promote health. So that's at 9 a.m. to 11 a.m. this Saturday at Hampton Park. And this benefits the Wellness Works program at MUSC that promotes healthy weight and healthy living for children and families. And then, as Councilman Shealy probably knows, our city has supported 2 big infrastructure projects recently. So just letting everyone know, like continuing to communicate your support for these types of projects or letting your council people know if you do support them, the city had a groundbreaking 3 weeks ago for the Ashley River Crossing, which will be a standalone bicycle pedestrian bridge between downtown, the medical district, to West Ashley, which will connect to the existing 9 Mile West Ashley Greenway. So a huge opportunity for recreation and transportation related activity. And then the city funded phase 1 of the Low Country Low Line. And so that will be a 1.6 mile path that spans most of the peninsula. Eventually, will probably span the entire peninsula. And again, will offer a lot of opportunities for both recreation and active travel for adults, for kids. These spaces are really important. Having low to no cost and safe places for kids and adults to be active is a key way to prevent heart disease. So there's a lot going on in our community, which is exciting. And I just wanted to share that with you all and thank Councilman Shealy for his support on some of those recent efforts.
Great. Thank you, Morgan. Appreciate all that you're doing too. All right. Anyone else? I see Nick Osborne turned on his video. I don't know if that meant he wanted to speak with us.
Thanks, Councilman Shealy. Yeah, so apologies. I've had big trouble with my internet connection. Oh, and it's gone again.
Uh-oh.
We hear you.
We can hear you. We can't see you, but we can hear you.
Okay. No, so I will say it's just we have our annual Chef's Feast coming up at the end of February. This is our 26th annual Chef's Feast event. It's an opportunity for us to draw attention to issues of childhood hunger. It's a great gala. We have about 450 people attending. We are sold out, which is great. So we are able to get out to a wide audience. It's an opportunity for us to give an opportunity for chefs in our local community to demonstrate some of their abilities, but also to identify and demonstrate that connection between food and the great work that our chefs do in our community as well. A huge thank you for Paul. Paul's going to be in attendance as well, so thank you, Paul, for coming. But we are looking forward to a great event again, not least to be able to highlight some of the challenges and issues associated with childhood hunger in our community.
Great. Thank you, Nick. Any questions for Nick on that? Thank you for that. Appreciate you adding that in for us. Anything else on our community updates, wellness updates, Paul?
Well, more about our March meeting. Dr. Key will be coming in to talk about and bringing into Boeing Wellness, Children's Wellness Center in. And what I really hope that if you haven't ever learned about the school wellness scorecard and what they are doing in our community, it's a foundation that we all can be a part of helping those schools. And it's a great tool to listen to and gather that information. And then hopefully in April, I think I'm going to change our little meeting tone and have somebody to talk about physical fitness and getting ready for the bridge run 2 to 3 days later. So hopefully that'll be our next 2 months. We'll really try to focus on physical activity and getting people moving. So
very good. All right. Anyone else?
know.
Maggie Dangerfield.
One quick one to dovetail on what Paul shared. So you may have seen the op-ed in the paper that Superintendent Huggins authored at the end of the holidays in December about launching Adopt a School initiative. And we're really excited. That initiative is been branded and called Local, linking opportunities to classrooms and learners. And we're getting ready to roll that out this week. And a lot of it would be similar to like Dr. Key's Adopt a Doc program she had for several years, where businesses are able to come in. We've met with schools. We've developed school profiles to identify specific needs of students, teachers, and families. And businesses can come in and partner in a myriad of ways to meet those needs across the board. So we're really, really excited about that, to holistically support our schools, support our families, ensure our students are in school, and that they are receiving all of the resources and support needed along with our staff and our families. So more to come on that this week. And we're really excited to engage with everyone in this way and get the initiative off the ground.
Great. Thank you, Maggie. All right. Anybody else? If not, I just want to say thank you for your time. Appreciate it. I know your time is very, very valuable, and we appreciate you taking an hour out of your morning this morning to help the city of Charleston and our whole community stay healthier. So if there's nothing else to come before this committee, we stand adjourned. Thank you.
Thank you.
Thank you.